So Jess, I really just want to thank you for helping me with my project today. So the first part of the project is to have a video and just talking about like the effectiveness of communication in nursing, which is your profession and will be my profession down the track. Now, so can you just tell me what is the role of communication in your profession?
Well, I guess communication in nursing is very important because you're dealing with a lot of people who are going through a lot of, very intense emotions where they're excited that an operation's gone well, or, sad that a loved one's unwell or possibly passing away. So you really need to be able to read patients and their family members to know how to correctly respond to these situations and to be able to help them effectively.
Okay, yeah. So, could you provide me with a few, just examples of what type of communication you would use?
I guess it's just a minor situation, but last night, we had a patient, some family member, who was obviously very stressed and worried about her husband returning from theatre, and it was surgery that had all gone really smoothly and was fine. She was pacing back and forth and kept coming and asking for updates, which we didn't know anything yet. So she was obviously very upset and worried. So I went and asked her, how she was, and just continued to give her updates on the fact that we'd update her. Offered her a cup of tea, and that was enough to help settle her and help, her gain trust in us that we, cared about how she was feeling and about her husband, and that she could rely on us and know that, we were there.
Yeah. So obviously, I haven't actually been on placement yet or had any nursing experience. So could you tell me, what would happen if it wasn't used effectively and communication wasn't there?
Well, I guess in that situation, this lady, if we hadn't have, helped put trust in us and to, really listened and looked at to how she was communicating with us, she could have become quite hostile towards us. And when a patient's family member or the patient, they don't feel like they can trust you, they make your job very difficult, constantly calling you for little things and asking you, lots of questions, just, not leaving you to just do your job. It can make it very difficult, what should be a nice shift, a really tricky, annoying, difficult shift.
Okay, so correct me if I'm wrong, but you're really talking about, the skill of developing rapport, right?
Definitely.
And also just maintaining, respectful therapeutic, relationships and developing those more. Is that right?
Yes, in nursing, probably that's one of the most important skills you can have, alongside all your clinical skills. Being able to develop rapport with family members and patients is probably the one, and doctors and, all the people you're working with. It's probably the most important skill you can have. Yeah.
Okay, so could you also just tell me also what would another type of effective communication be?
I guess they have a really big emphasis in the hospital systems these days about patients being involved in their own care. That involves, making sure you're constantly updating them and communicating with them what is happening. Letting them know, your X-ray, that's going to be delayed for half an hour, or this is going to take a little bit longer.
Yeah.
Just so they feel like you're involving them in their care, I guess.
So being a nurse on a surgical ward, I assume that it's very difficult that you'll just have to, with communication, you'd have to make sure to say the right thing at the right time. Is that something that you experience often?
Yeah, that's something that comes with experience as well. You sort of learn, to pick up on people's, I guess, their emotions and how they're acting towards you, and whether it's appropriate to keep talking small talk or whether they would rather just sit and be worried, or people will react differently to stressful situations. So just really being able to read people and respond appropriately is very important.
Yeah. Okay. So you've just said a lot of things there. So for my understanding, would you mind just explaining again, just really what the importance of saying the right thing is? How would that happen if you didn't say the right thing?
I guess reassuring people in nursing, it's very important emotionally to be able to help patients be reassured that they're scared, they're stressed, and helping them know that you're going to do the best for them that you can, and that the doctors are doing everything they can for them. Is that sort of the things that you're looking for?
Yeah, so that's just what I was wondering. Just to know when you said things like reading their body language, and I was just wondering whether that was the same thing as what you were talking about. Okay, so now I'm just also wondering whether you could tell me, just for my understanding,